The following is a project of our nonprofit newsroom. Support Midcoast Morning and local community-centered journalism today by signing up to be a monthly sustaining donor at chly.ca/donate. It doesn't take much money to support local news.
Midcoast Morning. I'm Joe Keaton. We'll be focusing on healthcare and housing on today's show. How could the raft of housing announcements we've been hearing from the provincial government impact Nanaimo? We'll get the thoughts of a VIU professor who works in the non-market housing space. But first, a new hospital, a cardiology program, and more staff are all needed in Nanaimo, according to Dr. David Coupland. He's head of the Nanaimo Medical Staff Engagement Society, and he joined me to give an insider's perspective on how to improve care at the Nanaimo Regional General Hospital.
My name is Dr. Dave Coupland. I'm a radiologist by training and nuclear medicine physician at NRGH for 27 years, and I'm president of the medical staff there. Have been for the last 4 years.
And so from that perspective, inside the hospital for 27 years, what would you say are the biggest things you would like to advocate for healthcare in Nanaimo?
Well, I guess maybe a bit of background might help. First of all, we all know that from outside the hospital, we have a problem with, family physicians, and obviously we need more supports there, and we're getting them, and hopefully we're turning the corner there. But that's a big part of, preventing people coming into the hospital is having adequate family physician support and all the things they need. And I think that is improving in the province, and hopefully in Central Island as well. It will take a while for that to happen, though. The government's done some good things there, and we're hoping that will lead to a few less people showing up at the hospital. However, if we now move to and there's other things needed in the community with drug addiction and mental health, but if we move to the hospital, and more specifically NRGH. So some background, NRGH is what we call the tertiary or large hospital for Central and North Island, designated by the ministry around 2008. And that means we're to provide certain services for Central and North Island exclusively at NRGH. One thing is we have approximately 460,000 people now north of the Malahat based on the 2021 census, I believe was the last one. We're actually greater population than South Island, south of the Malahat now. We're older, the oldest population in Canada and Central Island, and we're growing faster. So unfortunately, our demands have increased rapidly over the last 20 years. And what our medical programs and stuff really haven't kept up with that population growth and that demographic. And that's, we're not blaming anyone for that. We're all to blame for that. But it, really for that size of population. Now, some of that population can go to Victoria, but a lot of it can still come to Nanaimo when they choose to. But for the size of population and that demographic, we really don't have many of the programs we would normally have for that population. And we don't necessarily have the facility, the physical facility, for that as well. Our hospital has started construction in 1961 and it was finished in 1963. We definitely need a new facility to deal with the number of patients we're seeing, the disease burden and the acuity, and the volume we're going to see in the future, which is ever increasing. We're sort of overwhelmed right now at our facilities.
And by the sounds of it, you described there both staffing challenges with the building, challenges in kind of services that a hospital of that size you would expect it to have, resources, facilities that it doesn't. How would we begin to address that?
Well, we've been working closely with Island Health. We first identified and we had a plan in 2017 that identified many of the programs we don't have that we should have. Like, for example, we're trying to build a cardiology program. We've been trying since 2010. Normally, a population of our size and that mix would undoubtedly have a cardiac program and probably a cardiac cath lab, not necessarily cardiac surgery, but with our age and the number of patients we have, that would be a program we're lacking that we would normally have. And there are other programs such as greater neurology and certain aspects of gastroenterology, such as inflammatory disease clinics and stuff. There are other programs too that we don't have or are incomplete. There's many that are incomplete as well. And as I say, it's a function of as we grew, we just didn't develop for whatever reason. And so this plan in 2017, the other big one was cancer, by the way. We have, just to give you some background on incidents, we have 53% of the cancers occur north of the Malahat. We don't have an oncologist here anywhere in the north or a cancer center. However, the government, Premier Horgan, promised that in 2020, and we are getting that in 2028. So that was the one big win we've had. But for other programs for cardiac disease, we have a greater burden of cardiac disease in every category of cardiac disease when compared to South Island. We're above the provincial average in incidence, and they're below. So we definitely need a cardiology program here. And as I mentioned, we started planning with Island Health and working with them in 2017, and we've had some smaller wins, and certainly we've looked at a lot of data, and they agree that our needs are legitimate. This is for all of Central North Island. We need this tertiary hospital for strokes, for trauma, for cardiology, cardiac disease, and for a multitude of other programs that, people just cannot access the care they need in a timely manner in Victoria anymore. There's too many people up island. They're overwhelming Victoria too. So it is, and if you look around the province, we're underserved, relatively speaking, for our population. And Island Health agrees with us, and we're raising awareness of this right now, and we're trying to get these things. So we're working hard with them.
Can you help explain maybe how some of the logistics of making changes to our healthcare system works in between an organization like Island Health, in between the provincial government, and then how that translates into the healthcare people access in Nanaimo?
Yeah, it's not a simple process because you have to first identify, and like I say, we had a plan that looked at our data, the demographic and everything, and you have to do all that, but then it has to go to Island Health Board. They have approved most of everything we've talked about, that the need is legitimate. Certainly, those are major hurdles, and they have to have data and have to have looked at various areas. So that takes a long time. And then you have to then it has to go to the ministry. And there's a long process for these things to occur at the ministry, generally speaking, where they look at data as well. But then they have to figure out things such as, where does it fit into the priorities across the province, and costing, which can take a long time. And, we're talking about not just one program and a new hospital. We're talking about, so those are, each thing would be something on its own. So when you're talking about a batch of programs and a big new hospital to house them, it can get quite complicated. And, a lot of work has been done on this already, but we need to push that across the line at the ministry level before they need approval in principle, and then they actually have to go get the funding. And that's the last step, but it can take a while for that. And then those programs, once you get approval, you have to hire the staff and the people. And it's interesting because some programs we don't have any problem hiring, and other ones is more difficult. One thing I should just comment on is about our physical facility. We did have a review in 2010. It's an extensive review, 386 pages, and it definitely states that our facility needs to be replaced, and that it's past its best due date for sure. So we're not just making that up. There's a good hard document on that.
One of the things you mentioned off the top was a shortage of family doctors in Nanaimo. Is that something that you see play out at the hospital, and if so, how? Yeah,
it's interesting because we have a shortage of family doctors and specialists both, but the family doctor shortage definitely plays out in the hospital by people who, I think we're like the rest of the province, and I think we had about between 30 and 35,000 people without family doctors in the greater Nanaimo area. And many of those people are people who are in a lower socioeconomic status, may have mental health or drug addiction, but many are just regular normal people too, working. But when people cannot get the care they need when they need it, they often end up in emerge. First of all, not necessarily appropriately, because they should be seen in a non-emergent. So they take up spots in emerge, and you can't blame them. They have nowhere else to go. But also, if you're a person who has many comorbidities and you have mental health problems or drug addiction, you end up coming back to emerge, and then you don't have a family doctor to look after you come into hospital and you're discharged. Let's say you go back out in the community, 2 weeks later you're back in emergency. So we see multiple repeat, the same people coming back, because when they get out in the community, they don't have a family doctor to look after them. They're in a disadvantaged situation, and they end up back in emerge, and that's not good for them. It's not good for anyone. And the average person has to come into emerge often if they don't have a family doctor. And for them, it's the same thing. They may come in much later in their disease or much worse off than they would have if they'd had a family doctor to look after them and nip things in the bud and get them tested earlier or whatever. So it definitely contributes somewhat to our volumes in emerge and our volumes in hospital, which, and as I say, we have roughly 360 beds in our hospital. And I mentioned to you that we have over 400 patients on average. We had 436 patients a couple of weeks ago. So that means we've got 50 to 80 patients in the hospital without in a stretcher, basically. So that's another reason why having family doctors and having many more in the community to look after people and to prevent them having to come to hospital unnecessarily is an important part of this whole solution. We recognize that. That said, just our population, our numbers and our age and our growth, we're going to have a lot of people coming into the hospital here regardless. So we need to do everything we can to mitigate that. So
another subject that's come up in a number of conversations I've had in the community, and I've heard it raised at island health forums, is that Nanaimo just has one walk-in clinic operating currently. I'm wondering if you can maybe shed some light on the logistics of that. For example, this month it was announced that 179 more family doctors have come to the island over this time last year. Is there any kind of mechanism to open a walk-in clinic besides a doctor deciding to do it themselves?
So I am not the best person to ask about walk-in clinics, because I work, as I say, I'm the medical staff president. We're hospital-based. So I'd be a little hesitant to answer that. And I think you're much better off going to some of the community-based docs for that answer. Honestly, I wouldn't do it justice. It is unusual that we only have one walk-in clinic. And I know there are a bunch of initiatives out there to try to deal with that. And, we're looking at, and that again is, you're dead right though. It is about expanding the number of and scope of family physicians and other healthcare practitioners that can contribute, such as nurse practitioners as well, into this. And there are some initiatives that looking at some other walk-in clinics, or I guess that's the term you're using. Yeah, walk-in clinics or outpatient clinics. Urgent care clinics is, I think, maybe a slightly better term. But there are some initiatives for that. It is unusual to only have one with a population like this. And, but it does require more manpower, and family physicians and nurse practitioners are both in short supply. We're actually looking to try to bring some more family physicians and other practitioners into the hospital to help offload the workload there, but they're needed in both places. And I'm sorry, I can't answer directly that question. I'm really not the best person, and I just know there are initiatives out there. And you're right to ask that. That's a definite need we have. That would help offload the emergency and provide a place for people to go other than the emergency. So it's something that needs to be looked at. It is, but I don't know the details well.
You've talked a lot today about maybe what I think would be fair to call some discrepancies between the healthcare available in the central Mid-Island region compared to the South Island. How can people listening do something to try and address that or advocate for that?
Well, I think there is, and like I say, we're not blaming anyone, but there is inequity and there is lack of access. And you just look at the numbers and what we have in terms of programs compared to South Island. They virtually have pretty much all programs except transplants, and we are missing many, many programs with a similar population. And like I say, it's historical and it's happened, and we're all to blame it. But it's time. It's time we started to address this. So I think. Sorry, what was the question?
Well, so if people are living in Nanaimo and they want that to be addressed,
right.
What can they do?
Yeah, so I mean, I think you just make people aware that we are underserved relative to other people in BC and other geographic similar areas, and you need to talk to your elected politicians, your local politicians. Particularly we do have unanimous support from City Council for a new hospital and most of the things we've talked about, and from our regional district. But you need to talk to Mayor and the Council. They're supporting us all the way. The regional district, we need to talk to our MLAs, and they're well aware of this and they're advocating, but it's tough. And I think we need to let them know that we need these things. So, and your MPs, same thing. They all need to advocate in our behalf. So talk to all of them, make all your neighbors aware, if you see fit and want to know and you need to know some details, or you can write these people as well, and you can write the ministry and the various your various politicians and our people in Victoria.
Dr. David Coupland is head of the Nanaimo Medical Staff Engagement Society at the Nanaimo Regional General Hospital.
Midcoast Morning is made possible by the Community Radio Fund of Canada's Radio Meters program and listeners like you. Support Midcoast Morning and CHLY's nonprofit newsroom today by becoming a sustaining donor at chly.ca/donate. Local news can't survive without your support. Another way to help us out is to share this show with your friends and tell them why they should support us. Finally, if you're listening to the podcast edition of Midcoast Morning, go and give us a positive review on Apple Podcasts or whatever podcast feed you use. It helps people find us.
There have been a suite of housing announcements over the last few months. From restrictions around short-term rentals to a new home flipping tax to measures intended to construct new rental housing faster. Notably, the province announced a program called BC Builds last week, aimed to quickly construct new rental housing. Delivered through BC Housing, the program will leverage government, community, and non-profit-owned land to speed up construction. The government says that studio apartments built through the program would be affordable to those with an income of at least $85,000 a year, while two-bedroom units and larger would be affordable to families with incomes greater than $135,000 a year. To try and learn more about the impact these policies could have in Nanaimo, I got in touch with Kaeley Wiseman. She's the principal of Wiser Projects, a group of professional planners in the non-market housing space. She also teaches in the Masters of Community Planning program at Vancouver Island University. Maybe a good place to start would be BC Builds, which the government says is intended to quickly build rental housing for what it describes as middle-income earners. Could you maybe tell me a bit about that program and what you imagine it's going to do on Vancouver Island?
For sure. So as I understand it, and most of us only have access to the information that's publicly available so far, but there was quite a bit of consultation over the last year, I would say, for those of us involved in different aspects of the housing sector in building this program. So my understanding is BC Builds really uses not just government-owned land, but public-owned land, community-held land that's deemed underutilized, perhaps in urban areas mostly. They leverage that land with lower government borrowing rates, so lower financing, as well as potentially grants if you're going to deliver some below-market units to really expedite the process of delivery of market and non-market housing and help bring construction costs down. And so I guess the idea is if the province is involved, they'll provide a bit more surety and certainty about delivery timelines and process, as well as surety about the financing and who's going to pay for this at the end of the day.
Now, the government says that BC Builds is intended to create housing that is affordable for household incomes from $84,780 is the starting point for a studio or a one-bedroom home, and then $134,400 is the starting income for a two-bedroom home or larger. You're very involved in the planning and building home world. What does it say about the state of things that we need a special government program even to build homes that are only going to be affordable to families with an income well over six figures?
It sounds on paper substantive. I realize that. So I think we're very lucky in BC. I think folks need to remember that an entity like BC Housing only exists in BC, for example. A one-stop shop of housing only exists here. We've worked across Canada. There's no other one-stop shop like we have here. So historically, we've been lucky to have BC Housing because they have really focused on the low end of market. So truly deeply affordable, right through the housing continuum of supportive housing, with folks living rough, shelters, transitional housing. So why these numbers seem so big for this targeted missing middle is because it is an area traditionally we haven't focused on. It's been a gap in housing provision. And it sounds crazy, I think, to hear that these people are suffering, but we all have friends and family, even parents who are downsizing, who can no longer stay in the market because of the pressures. And so I think what the province is trying to do is say, hey, we've been focused on this end of the housing continuum for so long. We're now trying to address this missing middle piece, which the government also knows helps support the larger socioeconomic drivers of our province. And so the more we can keep and retain workforce housing, for example, which a lot of this would be, the stronger our entire economy will be. And so the numbers seem substantive, but I'll also say that every year, BC Housing puts out something called the BC income limits, the housing income limits, or HILLS is the acronym. And that looks at different regions across the province, both very localized regions as well as rural areas. And they every year print housing income limits for folks that can qualify to be in any BC Housing unit. And those numbers have always just been on the low end of market. So workforce, $80,000, $90,000 a year, those have always been the housing income limits for BC Housing for folks to qualify. So those aren't new numbers for those of us in the housing market, despite on paper them seeing extremely high, I think, for a publicly funded program.
You use the phrase missing middle in there. It's something that we hear a lot about around contemporary dialogues around housing. In Nanaimo and in and around surrounding communities, can you tell me what missing middle refers to? Do we have a missing middle here?
Yeah, every community does, rural and urban. Missing middle housing, a lot of folks talk about income limits, but that's a small component of it. It really is about delivering a range of housing scales and buildings, so in different sizes and forms. That's really what missing middle talks about. It's that we've really missed the boat on delivering a suite of options for folks throughout their life stages. And so that would include, you hear a lot about multiplexes, like the SMU legislation that the province has rolled out. The infill project would focus on, 2, 3, 4, 6 units on a site, townhouse forms, all those forms that are not really single detached houses, because they come at different times in people's lives, but they also come with a range of affordability. And so that really is the focus of the missing middle, is on range and typology more so than a specific income limit.
And another aspect of the plan is that it is trying to build homes on either publicly owned land or underutilized land and spaces. Is there anything you can say specifically about the Central Island region when it comes to, is there that land available to build on in the first place?
There is. I mean, every community has these sites. A lot of folks might know that in general, our government owns most of the land in Canada. However, especially southeast Vancouver Island, and I would say that would be around the Nanaimo region as well, there's a substantive amount that is owned by Crown Corps and then actually have been transitioned to different forestry entities and resource entities over the years. So it is a unique area in that there's probably less traditionally available than there might be in other regions. That being said, we all know that there's a lot of government land, and I would categorize Crown corporations as part of this, including health authorities, where there's a lot of parking lots that are busy from, 8 a.m. to 4 p.m. every day, much like Vancouver Island University, that have complete opportunity to be used in a multitude of ways and a multitude of timeframes. So, for example, parking lots on hospital sites, school buildings, post-secondary, as well as primary schools. A lot of Indigenous territories, especially if they're getting freehold land through the different treaty and negotiation processes, and also rethinking how we redevelop our civic assets. So, for example, in the last few weeks, we've been engaging with a variety of municipalities who need new fire halls, police stations, municipal halls, recreation centers. Why have we notoriously built those as single purpose or use when they're on civically owned land and there's opportunity to deliver other community needs? So, for example, can we put housing on top of them? And the City of Victoria completed last year a really interesting project with a new fire hall right downtown through a public-private partnership. And they did deliver housing units on top of that. And it's a bit more complex from a constructability and code perspective, of course, but it is absolutely possible to get more out of these publicly owned sites.
Kaeley Wiseman is an instructor in the Master of Community Planning program at Vancouver Island University. She's also the principal of Wiser Projects, a group of professional planners in the non-market housing space. That's our show for the day. Thank you for joining me. I'm Joe Pugh, host and producer of Midcoast Morning. Jesse Woodward is our executive producer, and Arby Frew is our technical advisor. You can sign up for CHLY's newsletter at chly.ca/subscribe for updates from our nonprofit newsroom. Our theme song is First One by local Nanaimo band Waste Management. If you have a story you'd like us to cover, email us at news@chly.ca. That's all for now. I'll talk to you on another Midcoast Morning.
Midcoast Morning would not be possible without the funding of the Community Radio Fund of Canada's Radio Meters program and listeners like you. Midcoast Morning is a project of CHLY's nonprofit newsroom. Support nonprofit journalism in Nanaimo and on the Salish Sea today by becoming a monthly sustaining donor at $5 or more per month. Support the program at chly.ca/donate. If you're already a supporter, record a voice memo telling others where you're listening from and why they too should support our work. After you're done, you can email it to us. Also, share the podcast with your friends. While Meta is blocking Canadian users from sharing news content on their Facebook feeds, you can still share our podcast directly with your friends via Facebook or Instagram Messenger. Finally, this program acknowledges and gives thanks to the Nanaimo First Nation as we broadcast and podcast from their traditional territory. Thanks for listening.